Okay, ADHD meds. This is probably one of the people we're most familiar with. I put this on here because I really remember, this was years and years ago, but I had this parent who came in there. I said, you know, kid was classic ADHD. I mean, 5 minutes in the office, and he's climbing up my bookshelves, trying to pull things off, and mom just sits there oblivious. So I'm like, okay, let's try to help her. Here's some behavior management stuff. Let's keep him a little contained. And then when we started talking about, you know, maybe he needs something, because the school was like, please help us. He's beating up other kids and all these things. And I was like, well, maybe we should try medicine. And she was like, I'm not going to let you put him on those medicines because, you know, you don't have any information or data on these things. They've only been around for like 2-3 years, and you really don't know how these things work. And this is it's a conspiracy with meds, and it was kind of this big, long ordeal. So I always throw this in here so that if people really ask, the first time somebody reported ADHD symptoms was actually in 1907, way down here. Okay, and 35, there's a guy named Bradley that started saying, or 37, I think. He started actually using amphetamines at that point. So from 37 until now. So you're looking at what, 74 years of data that we have of methylphenidate and amphetamine. That's more than most any other medicines have been around, except maybe penicillin, you know, a couple other things. But it's been around for a long time. We have lots of data. We have lots of things talking about the safety and the efficacy. Now, is it safe? If every medicine's safe for every kid? No. Okay, you got to find what's going to work best for that person. The names have changed over the years, but they've been using the same medicine. So if you look at now, all the meds we have, Concerta, you look at Vyvanse, we're going to go through all these in a minute, Adderall, all of these things are all a different preparation of amphetamine salts or methylphenidate. The meds have not changed. The delivery system has changed. So if you're saying 70-some years of using something, it can be safe. Now the problem with that, when we talk about ADHD is overdiagnosed, it's misdiagnosed, it's overmedicated. I mean, I agree with all that. So you have to do it appropriately. Now, the big thing is everybody talks about what we're doing with the kids, and most people probably don't realize that last year, more prescriptions for stimulants were written for adults than they were kids, by like a big margin. Okay, almost 2 to 1, not quite. So more adults are getting these. Okay, so does that mean these were people who were ADHD and who are now adults, or is it for other reasons? I don't know. Okay, but I really think that we have to be very, very careful and very cautious when you use these meds. But they are incredibly effective, and probably some of the safest meds we have. So when we look at all the different ones, you look at the stimulants. Remember I talked about there's 2 main classes. You look here, Ritalin, Concerta, Ritalin long-acting and Metadate, and Focalin and Focalin XR. Everything above here are all methylphenidate based. Remember when I talked about Lexapro and Celexa, how they had 2 sides of the molecule, they rip it apart? Focalin, same thing with methylphenidate. Rip it apart, keep one side, and it was effective, okay? But does everything work for everybody? And just because somebody does well with Ritalin, does that mean they're going to do well with Focalin? Not at all, because the preparations are all different. They use different fillers and lots of various things. So you check and see. So then you look at the Adderall, Adderall XR, Vyvanse, Dexedrine. All those ones are part of that amphetamine salt group. And then Cylert is one that Pemelin, probably you may never see anymore. They used it for a while in the 70s, early 80s and stuff. It caused liver failure in some kids, and some kids had died from it. So pretty much it's one of those, it's still around, but nobody really uses it, so you want to be careful with it. So with the different meds, they all have similar side effects, and we'll talk about in a minute kind of how they're a little different about things. But the things you want to watch out for, they can cause headaches. Okay. Who here drinks caffeine? All right, let's say you have not had any caffeine for like a month, okay, and then you drink the amount of caffeine that you drink currently, okay? You're probably going to get a headache, or you're probably going to get the jitters and the shakes. You got to remember, these are stimulants. The difference between this and, like, let's say drinking a big thing of coffee is that caffeine is like a shotgun to your brain. It just blasts your brain with all this stimulant, okay? What these meds do is they actually are like a precision rifle, okay? So they go to your right frontal lobe, they go to your cingulate gyrus in your brain. They go to the 2 areas which are sort of, like, I would always tease kids, and now they give me blank looks. I'd say that they go to like what your Jiminy Cricket in your brain is. And I've had all these kids go, who's Jiminy Cricket? And I'm like, I'm old, so I'm thinking of new analogies or something. But it's kind of like your frontal lobe, you know, it's Jiminy Cricket sitting there saying, don't do that. You shouldn't go to the Pleasure Island. You shouldn't do this. Okay, and so that's what's keeping you saying, okay, I've got to listen to this. I've got to listen to my conscience a little bit. So these two areas of your brain are what, when you see a kid who's just impulsive and they just, bam, do things, like cingulate gyres will help you if they're impulsive and they want something, like, there's a piece of candy there and I want to get it, but what they'll do is cingulate gyres is what says, what, hang on, stop, don't just go get it. Okay, it kind of helps put some of that balance in things. So that's how these meds work. They work on specific areas, cingulate gyres and then your right frontal lobe. Okay, and just, if y'all are curious too, your left frontal lobe is actually more implicated with sort of bipolar and things like that. And your right frontal lobe is larger than your left. The more symmetric they get, the more severe your ADHD is. Okay, so you don't want to have a small right frontal lobe, but you probably have pretty severe ADHD. Okay, so it's always larger. The brain is very different, and that's how it works. But even having that information, there's too much variability with people that we actually can't do a brain scan and say, do you have ADHD with this brain scan? We can't tell because everybody's brain is so different. We'd have to somehow be able to predict what your brain should be and then what your brain is, and we can't do that. So, but because they hit the same areas, they cause the same side effects. So they can cause headaches, they can cause trouble sleeping, okay? And the reason is because if any of y'all drink coffee right before bed, do you sleep? Well, no, this is a stimulant. It's not that kind of shotgun stimulant, like I said. It's more precision, but it'll still do that. So if somebody misses a 12-hour lasting medicine and it's 2 in the afternoon, well, don't take it or they're gonna be up till 2 at night, okay? Stomach aches, that's usually if you take it on an empty stomach. You wanna make sure that there's something in there, even if it's just like milk. Okay, parents are like, well, my kid eats at school. Well, I'm like, fine, give it toast or give them milk at home if you give them their meds, if you don't want the school to give the meds. So that's one thing that you can do. The other thing is orange juice. Do not use these with orange juice. Orange juice negates the effect of the med, pretty much, within the first couple hours. So if you want to have orange juice at night, that's fine, but don't use these if you're going to drink orange juice. They can also cause loss of appetite and weight loss, which are some of the big things, but usually that's something to grow out of. When you think about your teenagers, there's not a whole lot of teenagers that are saying, I'm not eating, or a lot of adults who are on meds saying, I'm not eating because of this. It's mainly the younger kids, okay? And eventually they will grow out of that, and they're gonna grow to what they need to grow to, their size, their genetics, and stuff like that. So, let's see. Rare, you can get the tics if you see the facial tics or various things. Yes?
About growing out of the side effects. Do you have a lot of ADHD?
Yes and no. I'm not going to give you a definitive answer on that. Actually, I don't think I have that slide. I have one, let me see, I don't think I have it in here. I have one that I think I didn't put in here, which is a giant arrow. Let me make sure it's not in here. No, I don't have it. I have one that's a giant arrow that as time goes on, up into your teenage years, your impulsivity decreases. It naturally decreases. And also, though, I think you learn societal values that you can't just go up and take whatever you want. So the impulsivity decreases. The hyperactivity burns off a little bit when you hit those teenage years. Now, it goes from being climbing all over things to maybe somebody who just sits there and taps or fidgets. And so when adults come in, I will say, do you fidget? As opposed to saying, are you hyper? The attention problems change a little bit, but not completely. Okay? And so if you have somebody who's an untreated ADHD, they'll continue to have attention problems when they're adults. But the neat thing about ADHD is that we do a lot of kind of brain imaging studies and stuff like that. And there was this one study, I can't remember where they did it from, but they did this one study that they followed kids for 6 years, from when they were age 6 to when they were age 12. Various psychiatric diagnoses, but they mainly followed with ADHD. And they looked at 3 groups, and they had the group of kids who didn't have ADHD, the kids who had ADHD but were not on meds, and the kids who had ADHD but were on meds. And they followed these kids over 6 years. They scanned their brains at the end of that when they were all 12 years of age, and what they found is that the kids who didn't have ADHD, their brains were what their brains were supposed to be. The kids with ADHD who had been on meds but were not on meds when they scanned their head, their brains looked almost identical to the group who didn't have ADHD. The kids who had ADHD but had not ever been on meds had decreased right frontal lobe. They had difficulty with their cingulate gyres. So it used to be like when I first started this, I used to think, wow, I kind of feel bad. I mean, are we just like band-aiding kids and just giving them meds just to help behavior control? So now it's starting to look like with all the research and data, we're actually improving their brain, because your brain is rapidly growing and doing things. I mean, it's always changing, but the rapid stuff is into those early teen years and stuff. So it now looks like if we treat kids earlier, they do a lot better. But if you're an adult and you're starting something for ADHD because you've never been treated, we're actually just kind of band-aiding those symptoms a little bit more. So I've actually had a lot of kids now that I've been seeing for 10 years who are going to college or doing something else saying, I've got my job, can I try it off my meds? And I'm like, awesome, let's do it. Let's stop it and let's see what happens. Some of them do well, depending on what they're doing. They'll say, for work, I don't need it. But I have other people who say, you know what, I'm in school, I really need it maybe Tuesdays and Thursdays when I have class, but I don't have class Monday, Wednesday, Friday. So they function well without it on the other days, so they don't have to take it every day. So that's why it's kind of a yes and no. You know.
Do you have the name of that study? Do you know?
No, I'll have to find it. It was years ago, about 4 years ago. And I've been meaning to look it up, so this may be my motivation to look it up now. Because I had a copy of it, and I lent it to somebody, and now I don't know where it is, and I can't remember who did it. So, but it won't be hard to find out. So, let's see what else. Let's go to this one. We'll do this a little bit. Okay. So the other thing for ADHD is that usually we're talking about dopamine. There's other meds that are non-stimulants that can help out, and some of the alpha agonists. 10X, which is one, which y'all may have seen, and then there's Intunif and Catapress, which is clonidine. They work on these various receptors in your brain, and we're not going to kind of go into those. The guanfacine and 10X, I really like that. It helped with kids who kind of like were on a stimulant, but they still had a little bit of symptoms, more a little impulsive or some hyper symptoms. It worked great, but the problem with it was very short acting, and you'd have to give it like maybe 3 times a day, and I don't like dosing meds more than once, maybe twice a day. So with the Intunif, they came out with this Intunif, which is the same guanfacine we've been using for years. It's in a once-a-day preparation, so you can give it to them and it lasts 24 hours. So that's very beneficial. I have some kids who are on it by itself, some kids who are on stimulants by themselves, some kids who are on a combination of the two, because that's what they need. But you always want to try the monotherapy first, either way, and then before you switch to a combination. What it can cause, it does have some blood pressure side effects, so it can cause some sedation, it can cause some low blood pressure, decreased heart rate. So you kind of don't want to, and the one about stopping the medication suddenly, that's more for the clonidine, because people get used to having that clonidine in there, so you want to taper it off. It's always best to taper most any medicine, but those ones you really kind of want to taper. Other stuff, non-stimulants that are good for ADHD, one is wellbutrin. The problem with wellbutrin is when you start learning about the brain and you know which neurotransmitter systems in your brain are developed at what time, your norepinephrine, which wellbutrin works on, doesn't get really established in your brain until 12 or 13. So if you put a 6-year-old on this, it's not going to help. And it's not super robust for the treatment of ADHD. Now, I have a lot of adults, though, that I could put on wellbutrin for ADHD, and they do pretty okay if it's like a milder case. So sometimes it works, sometimes not. Okay, so it's one of those that should not be a first line, but it should definitely be in there as one that's a good option. And then there's Strattera that's out there, which is a selective norepinephrine reuptake inhibitor. Similar kind of thing. I've had some younger kids who do well with it, but more often teenagers do well with it because you get this group who their norepinephrine system is in place, that is established, and it works really well if people have sort of inattentive ADHD. All right, sleep medications. I think this is like the only slide up here. I don't have a lot of description about them, but if you look at these sleep medicines, by far and away, I think the thing I recommend the most is melatonin. If any of y'all have ever used melatonin or whatever, you can recommend it to people. You have this little gland, your pineal gland, in the back of your brain, and when the sun goes down and you're not getting UV light in, this little gland releases a little bit of melatonin, and that's why at sundown, you notice how we all kind of get that little sleepy, wow, I'm a little sleepy, because it's melatonin hitting these natural receptors in your brain, your melatonin receptors. And so what happens with this is, because we're not at a time where most of us go to sleep when the sun goes down, we kind of fight through that, and then you're still up. So what melatonin does is when you use it, it kind of hits those receptors in your brain. It's kind of a natural way of telling your brain, time to shut off, time to go to sleep. So melatonin, I think, is one of the best things. Doesn't work for everybody, though. Some people it works great for, some people not at all. It's always my first one. I think it's the safest one. I think it's the one you always want to use first and recommend to people. And it's over the counter, it's easy and stuff like that. Trazodone is the one that I use probably next most. It works really well too, but like I said earlier, it works if you let it work. If the kid's gonna fight it, it's not gonna work. Then you look at some of these others, okay? The one that I do not like is Ambien, okay? Because what happens with Ambien doesn't give you good sleep, okay? It's like getting hit on the head with a 2x4. It'll knock you out, but it's not gonna give you quality sleep, okay? So you'll be asleep, but you're not necessarily having the correct REM cycles and things that you need. So Ambien is kind of the one, it's a hypnotic, is what they all say. I mean, it'll knock you out. And I've had people who tell me, I get up in the middle of the night and I start eating and I don't remember it the next day, or they answer phone calls and they don't remember, what they said and things like that. So it's one of those that I've used it with people when you need to, but I kind of hold off on it as much before I try to use the other things. Trazodone and melatonin, you use those, and the phone rings or you got to get up and do something, you can still function. My wife actually, melatonin is what she'll use. She's a pediatric hospitalist, and so if she's on call at night, she may get a ton of calls. And if she's really tired but still kind of revved up from whatever's going on, the melatonin helps her fall asleep. But if the pager goes off or the phone rings, she can wake right up, she's alert, she can answer it, goes right back. Okay? So that's why I like it. The benzodiazepines that we talked about earlier, those they work really well. They kind of knock you out too. They take that anxiety, but they also don't give you the restful sleep. Lunesta is actually pretty good, gives you pretty good sleep. It's also very expensive. Remeron was an antidepressant at lower doses. It actually helps with sedation a little bit, but it's not actually a sleep medicine. And Sonata is just another one. They're all kind of variations, but the main ones, especially with kids, use what's safe. Those are kind of the best ones.